Hi guys, welcome back to another college review. And as I promised in this video, I'm going to review another branch at MGM Indore today, and that is going to be general surgery. Before I begin with today's video, I just want to clarify my purpose behind making these videos. These days, I feel a lot of scamsters are roaming around in the market in the name of counseling, guidance, mentors, and all, and they literally charge you thousands of rupees and provide you with nothing, no guidance, and only outdated lists that keep on circulating since many years. So I'm making these videos so you can take an informed decision during counseling and prevent getting scammed, like, and wasting your money by giving to these counselors, and instead doing your own research. These videos, I have promised to keep them as brutally honest as possible, and I'm not going to be sugarcoating anything. So these are based on my talks with the residents that I've had with working in these colleges, and I urge everyone to do their own personal research as well. So let us begin with today's video. The branch for today is general surgery at MGM Indore. As I mentioned in my previous video, MGM Indore was established in 1948. It is 1300 bedded. So in surgery, there are 6 units and there are 20 PGs in total. So coming to general surgery, the work, it is very hectic here. There are many wards. On the ground floor there is ICU, then on the third and fourth floor there are main surgery wards. So there's a lot of running around involved in first year, so that makes it very hectic. And the timings are not fixed, so there is one ad day per week, and the workload also depends on your speed. As in, initially you might have to come very early to do your pre-op work, but later on you can come a bit later in the morning. So a typical day would look like this: like from 7 a.m. to 9 a.m. you will have to do pre-op work, and then from 9 a.m. onwards rounds will start where all the consultants will come, and then after the morning rounds you will go to OT, which might continue till 3 p.m. or 4 p.m. or even 5 p.m. Then you do get some rest time in between in the evening. Then you will have your evening rounds in around 7 or 8 p.m. Then after evening rounds there is post-op work, and then you get to go home after the work ends, and that varies a lot. Sometimes post-op work might end by 10 p.m., or sometimes it may even continue till 1 or 2 o'clock in the night. So that varies. And now coming to academics, the academics are non-existent in first year. uh, Basically there are some classes do take place, but you hardly get any time to attend them, and some amount of academics do take place from second year, but it is still not at par. Now coming to postings, in you will be posted in general surgery mostly. Then for 3 months there is neurosurgery posting, CTVS posting, and pediatric surgery posting, 3 months each. And here you will get a good exposure to laparoscopic surgeries as well. Now, coming to hands-on, the hands-on is moderate here. You get to do minor procedures in first year like fibroma, lipoma, hydrocele, appendicectomy, varicose veins. Then from second year, some amount of hands-on starts, and you get a decent amount of hands-on in third year. Now, coming to toxicity, I would say yes, there is some toxicity, but the good thing is that it is only work related. Like if you do not do any work told to you by your senior, or if you're not sincere with it, then you will be scolded. But there is no personal talks, no financial kind of talks, or no physical harm. No physical talks will be there. There will be no offs in the month. Um, like you can take some a few hours of break by asking your seniors, but there as such no offs are given, and it is more relaxed from second year onwards. But in first year it is very hectic only. And speaking from personal experience, some amount of toxicity does happen when there is a lot of workload, and especially in surgical branches, in terms of cutting chances and all, some amount of toxicity does take place, but overall it is still manageable. uh, Before we move on to the cutoffs, I want to tell my final verdict that take general surgery here only and only if you are physically fit and really passionate towards the branch, because it can get very hectic, it can get very physically taxing. So if you can tolerate the workload, if you can deal with it, then sure, go ahead. It is one of the best institutes, the most premier institute to do your post graduation from. So you should definitely go for it if you're interested in the branch and you feel you can go ahead with the workload, because after you pass out you will have a very good prospect. Now let us take a look at the cutoffs. For general category in All India quota, it closed at 4,506 rank in round 3 in 2024. There were 4 seats for general category, and in round 3 in 2023 it closed at 5k rank. For EWS category, there was only 1 seat in 24 and it closed at 6k rank, and in 23 it closed around 11k rank. In OBC category, it went till 12k rank. There were 3 seats in 2024 and the same in 2023 as well. In SC category, in 2024, it went till 29,000 in round 3. There were 2 seats and 28,000 in round 3 in 2023. In ST category, it went till 40,000 rank in round 3 in 2023. There were no seats in 2024. So that is all for today's video. If you want any specific want me to review any specific college or course, please feel free to comment in the comment down below. And if you want any personalized guidance, please feel free to reach out to me. Thank you and see you in my next video.